Hi, welcome back. This is Therapy Twins. I'm Joan.
And I'm Jane.
And today we're doing part 2 of DNA guided medicine. Feel free to look through to back to video 2, I believe, is where I did DNA guided medicine, but there are so many updates because why, Jane? The worst side effect.
Oh, don't ever ask me a question.
I will.
Don't ask me
a really hard question.
Don't ask me a question if you're going to answer it.
The worst side effect of a medication is, and I do have the answer, but do you have a thought? What is the worst side effect of a medication?
Death.
Yeah, I knew you were going to say that. But
Sudden
really,
death.
If you don't die, the worst side effect of a medication is when it doesn't work for you. And in DNA, nicely put, yes. In DNA guided medicine, that only helps you get onto the road of recovery more quickly.
Joan, could you kind of explain? I know people can go to video 1, video 2, but when we're talking about DNA guided medicine, what is it that we're talking about?
We're talking about enzyme pathways in our liver. We all have DNA throughout our body, but think of enzymes. They are the workhorses for our body.
So what we're not talking about is my ancestry might go back to Pontius Pilate or Marie Antoinette.
Later we're going to touch on ancestry, Jane. Thanks for bringing that up. Could you remember that?
Most of
You want to jot that down?
No, I have
You'll remember it. Okay, so say for instance you take a medicine and it's going to go through one of the 3 major pathways in your liver where most medicines go through. As an update, there's at least how many being tested?
Currently, there are at least 5 genetic testing companies that have barged right into our offices, not just Connecticut, and they're testing up to 4 pathways and then some other things like that we're not going to touch on, transporter systems,
of serotonin,
receptor sites, because the science is kind of still new in that area. But right now, I mean, I think you mentioned in your second video on part 1 DNA about that this has been a long time coming.
Oh, and it's been out since at least 2007. We started doing it in our practice since 2009, and people are amazed. They've been through 14, 15 med trials. They go through this DNA testing, and there's at least, most people, once you got it right, maybe sometimes twice. But getting back to the enzyme pathways in your liver, we did talk a lot about the 3 pathways, but there's something else going on in our liver as well. How efficient are our enzymes? Do we have reduced activity in our enzymes? There's something called metabolic reserve, which is extremely scientific, but complicated. Let's bring it down so that everyone can understand it. Let's call one side of metabolic reserve ultra rapid. Let's call the other side ultra slow. So if you have, for instance, a 2.5, you are most likely afraid to take medicines because you have experienced every side effect or adverse reaction to anything, or you took a Benadryl and had a difficult time waking up the next morning. If you are ultra rapid, you may need 2 or 3 Benadryls, which we're not recommending, and you may need another Benadryl in the middle of the night. Again, we're not recommending that.
So what we're talking about is preventing adverse drug reactions,
Yes.
Getting the medication correct the first time,
Hopefully.
via a scientific background,
Yes.
and preventing hospitalizations or lengthy hospitalizations, because we all know that adverse drug reactions kill over 100,000 people per year. It also accounts for how many?
8 million unnecessary hospitalizations just by adverse reactions alone. And we're not saying that if you take a medicine you're not going to experience a side effect even though your liver is working perfectly and those enzymes are working perfectly. Remember, side effects we expect, adverse reactions we do not expect.
This genetic testing is testing my liver might be different than your liver. Basically, that's not true, though. But
because we're identical twins.
It's not talking about liver damage. It's genetically we're all different. So, it's right now it's kind of not common for. What's your favorite word for humans?
Humans? Oh, Homo sapiens.
It seems that it's not cool for Homo sapiens to kind of like this pathway called CYP2D6, and we're not going to talk too scientifically here. We're going to dumb it down and get get it very understandable for people. And why is that the case? Nobody knows. But a lot of medications rely very heavily on one of these pathways.
And some of them are common. We're not talking about, well, we are talking about Plavix and Coumadin and tamoxifen, the breast cancer medicine. We're also talking about Advil, Benadryl, anesthesias,
Codeine, oxycodone,
the proton pump inhibitors, Prevacid,
the oral hypoglycemics. That's an extremely
blood pressure pills. We're talking about a lot. Not all of them go through these pathways, and it doesn't mean that they bypass. It just means we're not testing for those pathways yet. And I'm sure in the future we'll be testing for most of them because it's a safety issue. It costs the country millions and millions of dollars in unnecessary healthcare costs, and that's a huge topic in today's world.
So what you're saying, Joan, is so some of the medicines rely very heavily on these pathways, and some of the medicines rely quite lightly on these pathways.
And some of the medicines go through more than one.
Which might be the reason why when the antipsychotics, when none of them work for a client, we go to the gold standard Clozaril.
Right.
And I don't think it's a coincidence because Clozaril or clozapine relies on 4 to 5 different pathways for metabolism, which might be why it works.
Now in our practice, Jane had mentioned ethnic backgrounds. We definitely ask your ethnic background because a lot of Eastern Europeans, Asians, a lot of Italians, Slavics, Polish, Native Americans, but I've had people Irish, Anglo-Saxon white. They've also had some problems as well, but there's a heavy or a higher proportion of some of these other ethnic backgrounds. So that's extremely important. If I hear Hungarian or anything like that, especially Italian too, we got ours done. Deficient, deficient, deficient. I was pretty shocked.
Well, for example, Crestor, which is probably Lipitor's biggest competitor, that treats high cholesterol, if you are of Asian background or race, you basically can't use Crestor. 2D6, I believe.
Right. And another huge thing, well, just to remind you males, Viagra goes through one of the major pathways, so you want to be careful with that. That is not something to just say, oh, I need a Viagra, let me take it. Why don't you check to see if you can efficiently, your enzymes break Viagra down through, I believe it's 2C9, but let's not go too scientific, again, like Jane says. That one of the newest things is if you are ultra rapid, and again, it doesn't mean because you're thin, you have an ultra-rapid metabolism. We are not talking about that.
We're talking about that pathway.
We're talking about our liver inside our body and the enzymes there. So if you're ultra-rapid and you're a child, well, if you're anybody, but the newest thing is children are going through surgeries and they're not getting the pain relief they need, but nobody wants to give more because that would be dangerous. So it's a very, very delicate thing to know. And if you do get this test done, it's very important for you, just like if you're a diabetic or if you have a seizure disorder and you wear a bracelet. It's very important if you are poor or null in these pathways, deficient is not as dangerous, to let your doctors, nurse practitioners, your anesthesiologists know about all of this. Do you have anything else to add, Jane?
No, I'd like, why don't we talk about a case study, 1 or 2?
Sure.
What's very rare is to be null in one of these pathways, and the more common one we talked about was 2D6. And so I had a client about 18, 19 years old, attending a university, and she had her first psychotic break. She ended up at an inpatient psychiatric unit and was given a very common antipsychotic that relies very, very heavily on that pathway 2D6. When they discharged her and she came to me, she had just about every side effect. If you looked up that antipsychotic, she had every side effect from that medication, and she did not have symptom relief from the hallucinations and paranoia. So and she was of Eastern European background, and Joan mentioned that, so I automatically thought of the DNA testing, and it happened that she was null. So I switched her to a medication, another medication that did not rely heavily on 2D6, and she got symptom relief and returned to the university. And actually, I think she just graduated.
Nice. One of the other statistics is if you've been hospitalized for over 10 days, you are most likely deficient in at least one pathway. So I think that everybody should be getting this done in their pediatrician's office, because as we mentioned, Benadryl is huge, especially for children, giving children Benadryl for colds and flus. So I wish this were done when you were a pediatric patient, but unfortunately,
Joan, I think that's the future.
that's the future, and unfortunately we're doing it as adults, which is okay. But if you have any questions about DNA testing, DNA-guided medicine, which test is best for you, just please visit therapytwins.com. Please feel free to ask us anything. I appreciate you stopping by.
We appreciate you stopping by.
I meant we appreciate you stopping by. Thank you.